Good afternoon, good morning, and good evening. A very warm welcome to today's session entitled One Health, One Welfare, Food System Opportunities for Better Human, Animal, and Ecological Health and Wellbeing. The COVID-19 crisis has certainly shone a spotlight on food and health like no other crisis has done in living memory. It has revealed the fragility and vulnerability of our food systems to sudden external shocks. It illustrates how the health of ecosystems and the health of animals can have a direct bearing on human health and well-being.
Whilst COVID-19 has been widely linked to the ill treatment of wildlife, a source of past and future pandemics, in my view, is industrial animal agriculture or factory farming. The nub of it is that keeping thousands of animals caged, crammed and confined is inherently unhealthy, producing the perfect breeding ground for disease. Highly pathogenic strains of disease can and do emerge. Only a decade ago, we should remind ourselves that swine flu from factory farms caused a pandemic, killing in the region of 500,000 people worldwide. Industrial animal agriculture is not only the biggest cause of animal cruelty on the planet, it is also a major driver of deforestation, decline in the world's wildlife, and a consumer of more than 2/3 of the world's antibiotics. It is also the single biggest source of food waste on the planet. 40% of our entire grain harvest is fed to industrially reared animals. If fed directly to people, it would be enough to sustain 4 billion people. This year's UN Food Systems Summit, in my view, offers a huge opportunity, an opportunity for a UN global agreement on food, one that recognizes food's central role in the success of addressing health, climate, and biodiversity challenges, one that sets a course toward a health-oriented food system without factory farming, without the over-reliance of animal-based diets, one that truly embraces that essential principle that protecting people means protecting animals too. In short, one health, one welfare.
My starting place is going to be, what is One Health? And I think we saw from the Slido response, One Health means many things, many different things to many different people. And I think that's an important thing in this conversation to be thinking about. You may be in a room with people and you may not actually be talking about the same thing. So I'm going to give a generic definition of One Health that UNEP abides by, and it's One Health as the collaborative efforts of multiple disciplines working locally, nationally, and globally to obtain optimal health for people, animals, and the environment. So what does One Health include? Often, much of the investment in One Health has focused on the people and animal side and less on the environment side of One Health. But the reality is we aren't achieving our food production or our food security goals, and we're doing so at the sacrifice of our natural world. And so that's where the Food System Summit is trying to push for. What are the transformations we need? So why is a One Health approach relevant to this? In particular, because it takes a systemic, holistic view of health outcomes. Why it's also relevant because it really aims to get at this concept of using all disciplines, working across them to define co-benefits. And the reality is to define those trade-offs that may have to be made to achieve these optimal outcomes. Context matters when it comes to One Health, and it matters when it comes to food systems. And that means in particular, investing locally in the solution sets for One Health. There are differential capacities. Around the world, people value food, they value the environment, they value health differently. And in order to find these sustainable solutions that work, that are context specific, we've got to recognize those different value systems and build those into One Health approaches.
I'm going to just take you quickly through a few perspectives from the OIE on this topic. And we'll start with having a look at the drivers for disease emergence, which were very nicely illustrated by Dr. Cameron Khan from Blue Dot at a conference, an OIE conference that he spoke at in 2018 on One Health and big data, which was a very interesting conference. Now, if you scan these factors on the screen, I think the key point to understand is that none of these factors are on a downward trend, and therefore the risk of disease emergence must be constantly increasing. A key aspect of this when we consider our food systems is that the supply chains are lengthening and becoming more complex.
One welfare is defined as the interconnection between animal welfare, human well-being, and the physical and social environment. The One Welfare approach can really help us to identify and address welfare and human well-being aspects as an intrinsic part of our approach, considering livestock as sentient beings alongside the well-being of every person connected to the food systems. This can lead to better treatment and better welfare for all. So my future vision is that One Welfare can not only complement, but also amplify the benefits of a One Health approach by integrating further professionals and aiming for a true holistic approach, which considers both health and welfare aspects.
So we find ourselves at an extraordinary moment in human history where we're essentially on a collision course with Earth's natural systems. And so as many of the speakers have talked about, to feed ourselves, we converted about 40% of land surface for crocodilians and pastures. 90% of monitored fisheries are at or beyond limits. We dammed 60% of rivers, obviously climatic disruption, air, water, and land pollution, species lost 1,000 times baseline rate, and roughly 1 million species facing extinction, many within decades.
I'm going to really talk about the work that we've been doing in conservation through public health since we founded the organization in 2003. And we basically founded CTPH because we were concerned about disease transmission between people and wildlife while working as a first veterinarian for the Uganda Wildlife Authority, where I was actually hired because we were concerned about diseases that tourists could bring in once gorilla tourism had just begun, such as a fatal flu like COVID-19. However, when I was hired, the very first disease we had to handle was not from tourists, but it came from the local communities who are very poor and have very inadequate access to healthcare and a lot of issues that are affecting the integrity of the park. So basically, the gorillas like to go outside the park to eat people's banana plants because of the very high human population growth at the edge of the park. And once they got habituated to tourism and research, they could now move outside the park because that was probably part of their former range. And they found dirty clothing on scarecrows and got scabies. It resulted in an infant gorilla dying and the rest only recovering after treatment with ivermectin. And that made us think that we need to start thinking about the health of the people if we're going to protect the gorillas. And so eventually we founded an NGO, Conservation Through Public Health, that focuses on this very issue.
Unless we adopt and implement One Health in India, which is a bigger challenge, the world and India risk facing many more pandemics in times to come. And finally, women empowerment, animal welfare also plays, of course, as we've talked about this, other speakers have talked about this, it plays an important role in human welfare. Brooke, an international animal welfare organization, estimates that 2/3 of livestock keepers, which is approximately 400 million people in developing countries, are all women. So they published a report called Invisible Helpers in 2014, and that showed that working animals like donkeys, mules, and horses have a major impact on the lives of women in countries like India. And in India, as in other developing countries, though women are doing most of the work with the animals, yet because of the socio-economic and cultural reasons, they don't have access to the income that is generated from the animals, nor do they have the necessary know-how to be able to improve animal welfare standards. So interventions to improve both animal welfare standards for increased productivity and women empowerment are really key to be able to increase women's participation in livestock-based opportunities.
At the Global Alliance, we've documented some great examples of how food systems can become healthier as well as more resilient, equitable, and sustainable when we work across sectors to address multiple challenges, whether it be malnutrition, food security, AMR, or zoonosis. We know that food systems transformation is possible and is happening, and it's time for all stakeholders, especially governments, to start taking action.
We are facing an emergency, a climate, nature, and pandemic emergency. And when things get tough, we need leaders to take tough decisions and lead us into a new future. That is what the Food Systems Summit has promised to initiate, to kick off. One health, one welfare. So clearly, on the basis of the conversation that we've all had this afternoon in this last 2.5 hours, shows that one health, one welfare is an absolutely essential component of a decent food system that delivers a livable future for all of us, be us people or animals on this one planet we all call home.